The Health Insurance Portability and Accountability Act, or HIPAA, was signed into law in the year 1996 by President Bill Clinton. It is a legislation which provides security provisions and data privacy in order to keep patients' medical information safe. The Act contains 5 titles, or sections in total. HIPAA Title I aims to protect coverage of health insurance for those who have changed or lost their jobs. It prevents group health plans from refusing to cover individuals who have pre-existing conditions or diseases and prohibits them from setting limits for lifetime coverage. HIPAA Title II aims to direct the United States Department of Human Services and Health in order to standardize the process of electronic healthcare transactions nationwide. It requires the organizations to implement safe electronic access to the patient's health data, remaining in compliance with the privacy regulations which were set by the HHS. HIPAA Title III is related to provisions which are tax-related, as well as general medical care guidelines. HIPAA Title IV defines a further reform in health insurance, including provisions for those who have pre-existing diseases or conditions and individuals who are seeking continued coverage. HIPAA Title V includes provisions associated with company-owned insurance and treatment of those who lost their citizenship for income tax reasons.
What are you doing today? No, I'm working until 5. We can go out earlier if you want. Yeah, we can go get Chipotle. No, it doesn't matter. I'll just leave. I'm sure no one will come in the meantime.
Yo, I hate Castle Branch. Stupid health forms. Oh my. I submitted mine like 10 times already. Excuse me, miss.
I'm on the phone. Give me 1 second.
Excuse me, miss. I need my immunization record so I can switch my primary care provider.
Okay, what's your name?
Your service is terrible.
Okay, take a seat and give me
Your
your
service,
name.
alright. It is Tyler?
Tyler.
Yes. Kendall, look it up.
It's gonna be a 15-minute wait.
What? What? Nah, I need it right now. I gotta go. I can't start class without it.
You should have came earlier.
I need it right now. Where's your manager? Where's Dr. Benz?
I am the manager.
Where's Dr. Benz? Where's Dr. Benz?
Hello, I am Dr. Benz.
I need my records right now.
Sure, you're going to have to wait for 15 minutes.
No, under
Everyone
HIPAA,
else-
I can have it right now.
Yes, you can have it at your request. However, there is still going to be a time wait that you'll have to wait like everybody else.
Alright. Thank you.
Mr. Tyler, here you go.
Alright. Thank you. Have a good day, Professor Benz. Tell her the service. She needs to be gone.
Patients' rights under HIPAA. The right to notice of information practices. An individual has a right to adequate notice of the policies and procedures of a covered entity that is a health plan or a healthcare provider with respect to the protected health information. Right to access to PHI. Right of access includes access to PHI with health plans, healthcare providers, business partner if records is not a duplicate. Access as long as records are maintained. Right to an accounting of how their PHI has been disclosed outside normal patient care channels. The right to full accounting of disclosures from CEs except for treatment, payment, and healthcare operations, and for certain disclosures to health oversight or law enforcement agencies. Also, the right accounting also applies to business partners. The right to request amendment correction to personal health information. Requests will have to either be accepted or rejected within 60 days. Rejections will require an explanation in plain language, and patients can still file a statement of disagreement.
Information that is protected under HIPAA is known as Protected Health Information, or PHI. PHI is any identifiable health information. It is held or transmitted by a covered entity or its business associate in the form of paper, electronic, or verbal. PHI can include mental health, healthcare, health plan information, test results, clinical notes, diagnosis, medical record number, admission and discharge dates, biometric identifiers, full face photographic images, and demographics. Demographics such as name, address, date of birth, social security number, phone number, email, and fax number. Although HIPAA strictly protects the sharing of PHI, HIPAA does not restrict healthcare workers from sharing protected health information when it comes to treatment. Caregivers are free to share protected health information when necessary to provide high-quality care for a patient. Payment. PHI is permitted to be shared to insurance companies, Medicare, and other private and government payers. Healthcare operations. This allows facilities to share PHI so it can contribute to quality improvement, protocol development, legal counsel services, and training. Protected health information can also be shared with the individual if they ask for it. Public policy. This is if there is an exposure and can affect others, or if the patient gives authority to share. However, a hospital is permitted but not required to disclose PHI without the patient's authorization. This is if it is required by law, public health activities, reporting victims of abuse, or judicial and administrative proceedings. Protected health information that is shared without necessary reason is a violation of HIPAA and the federal law. Information that is protected under HIPAA is known as Protected Health Information, or PHI. PHI is any identifiable health information. It is held or transmitted by a covered entity or its business associate in the form of paper, electronic, or verbal. PHI can include mental health, healthcare, health plan information, test results, clinical notes, diagnosis, medical record number, admission and discharge dates, biometric identifiers, full face photographic images, and demographics. Demographics such as name, address, date of birth, social security number, phone number, email, and fax number.
This is crazy. I mean, we've run many tests already, and he's pregnant. He is a biological male, the first one to be pregnant. It's very baffling. Johnson, get in here.
Dr. Benz, I just got the results back from the clinical lab, bro. You're not gonna believe this. This is our third time running it, and it is indeed confirmed that it is a male that's first time pregnant. And guess what? The fetus is supposed to be 6 months pregnant today.
This just does not make sense. And even worrier, where is it going to come out?
I don't understand.
Nurse, what do you think?
That's crazy. I'm gonna just send it to my friends real quick.
This is impossible. We've run 2 tests and they both came back positive.
I know, this is crazy. His gender is male. The third test should be on the way any minute now. Check the time. It's supposed to be there now. Let me go get it.
Now this sensitive patient information, but oh look,
Oh,
the results. They're back on the screen.
give me a second. That contains patient information. Let me put my phone away.
Some examples of technical safeguards are utilizing proper autofax setup procedures, automatic log-off/timeout, encryption technology, mobile device management, LoJack, which is hard drive wipe, and limitations on access. Also, it includes username slash